So, hey, I'm glad you listened. This is going to be a great year. We started off with a fantastic new year. The markets are skyrocketing. They're blazing. Cryptocurrency is through the charts. We have had no celebrity injuries or deaths. We have had no return of COVID. There is no other variant on the market. This is a I take that back. We're off to a stumbled start. I know. Truth and lawyers, they always get in the way. I was trying to be hopeful. But we know what's happening. But hey, at least the Niners are in the playoffs.
Watch Stafford go deep and picked off. Intercepted by Ambry Thomas.
And that's all that matters. We have J.J. Watt. Now, defensive lineman destroyed his shoulder. I don't want to say destroyed, but basically he had, count them, labral tear, cuff tear, biceps tendon, and he had a dislocated shoulder. So the dislocated shoulder probably went with all of that. He had his surgery late October. He is off the injury reserve and ready to play this Sunday. Let's talk about that. Soft tissues take 6 to 8 weeks to heal. You need to give time to heal and then time to rehab. This is less than 3 months, depending, give or take, from the timing of his exact surgery and exactly what was done. But even then, having all that repaired and coming back in less than 3 months in high level play is a risk. Okay, now I am sure they understand that. The interesting thing is, this brings up a lot of interesting questions about liability and patient safety and athlete safety and workers' injury on the field. Because technically athletes are workers because they are paid by a company, the athletic team, to have to pay for the players to work. So this is a work-related injury. This is a sports-related injury by an employee of a company. And you have doctors that have a business associate agreement, or in some cases they may be employed by the company. I highly doubt it. Most of them have a business associate agreement with the team. They have their independent practice and liability. They may or may not have separate liability to cover the athletes. And it is their job to keep their patient in mind for safety and recovery and return to sport. They make the call. There can be a conflict of interest between what the team, the general manager, the trainer, and the therapist, and the physician, and the athlete all want, sometimes on the same page, sometimes disparate. So what happens if a player wants to return sooner, or if a team pressures the entire workflow for a player to go back on the field sooner, or the player has a multi-million-dollar contract and gets paid for every game and bonuses he doesn't want to lose and doesn't care about rupturing his shoulder again in the short term because he just wants to get his bonus and his payments for finishing off the season and get his chances in and then do their recovery afterwards. I'm not saying J.J. Watt or his team physician or any member of the team or the NFL or any underlying body is at fault or at risk for any liability in this situation. But it's a great example as to what are the potential risks, mitigation strategies, repercussions, and liability associated with this phenomenon, where what one does off the field of a professional sport can oftentimes be very different from what one does on the field. Would an NCAA or college or high school or non-professional athlete be returned to play in 3 months or less after a major shoulder reconstruction or surgery? I don't know the specifics about exactly how many anchors, what kind of surgery, what kind of repair, what the quality of the tissue, the quality of the tendon. I don't have all the details on that because obviously that's health protected information. Everyone has a right by HIPAA compliance to maintain their privacy, even as a public figure or public athlete. They have HIPAA security in place. So what does this mean? If there's no way that patient could have been taken off the injury reserve if the doctor didn't sign off. And was there influence by the patient, by the trainer, by the coach, by the general manager, by the team? I have no idea. It happens. We deal with athletes all the time. Athletes are gung-ho about getting back to sport, getting back in the game, and they always want to play because that's what they love. That's their job. It's not just their job, it's their passion, it's their performance. It's what defines and shapes their career. So absolutely, they want to return. On the physician side, Hippocratic oath, we are the guardians of the galaxy. Oh, did I say galaxy? Oh, well, okay. Not the galaxy. We are the guardians of patient safety. Now, there's a lot of organizations, bodies, and committees and formal structure around who are the guardians of patient safety, whether it's FDA, whether it's medical associations, whether it's clinical practice guidelines, whether it's hospital safety, whether it's patient surveillance, whether it's review committees, credentialing committees, all of those things. All those things are important for patient safety. But as a physician and surgeon, you always take the patient into mind first and foremost. My personal opinion is 3 months after shoulder repair, if he had a labral injury, labral repair, and repair of maybe the rotator cuff tendons, maybe he had a partial biceps that needed repair or debridement with a traumatic dislocation, and he had the reconstructive surgery, I would not send that athlete into a game at 3 months. I think the earliest I would consider it is in the 6 to 8 months. That is my personal opinion, given in a general scenario without a specific patient in mind. You have to individualize it and be very patient specific. Every patient's different. Now, let's take that, for example, a superstar athlete has super healing, proteins. He has incredible growth factors, and he had augmented biologics and regenerative technology, and he had the surgery, and he had calcium, vitamin D, and full vitamin, herbal, holistic infusions and massages to no end. We should keep an eye on what happens when he returns to play. That is all I can say. I definitely hope, JJ Watt, you do well. I hope you do not injure your shoulder, but as a defensive lineman, your shoulder makes all the difference in the game. Thank you for listening.